Afternoon or good morning or good evening, everyone, wherever you are, and welcome to this panel on COVID-19 and challenges to democracy. So my name is Daphne Halikiopoulou. I'm going to be chairing this panel today. Thank you for inviting me to be the chair. I was really excited to be invited to chair this panel. I think we're going to have four very interesting talks on the various dimensions of the challenges that the COVID-19 pandemic has posed to democracy, democratic values, democratic society, etc. So before I hand to the presenters, I just want to very briefly, 2 minutes, talk to you about how I see this and what I see as the common threads that I would like to hear from the participants, and then do a little bit of housekeeping about how we will be organizing the panel today. So for those of you who know my work a little bit, I work on voting behavior, populism, and far-right parties. And that's why I find COVID-19 a particularly interesting phenomenon, because I think what it has done is that it has exposed both a lot of the weaknesses that our political systems face, but also has presented a lot of opportunities. So there are so many different dimensions from which we can study the phenomenon. I think one thing that COVID-19 has done from my political science or political parties perspective is that it has highlighted some important tensions. Firstly, tensions between efficiency in health policy and the economy. So we keep talking about this, if you want to make sure that we're safe and that we protect the vulnerable, then at the same time, we're going to have to harm the economy. So there's an important tension between that. There's also an interesting paradox that, funnily enough, a lot of the countries that we expected had weak health systems, look at Greece, for example, are some of the countries that have dealt with the pandemic in the best way. So in a way, there is a paradox of efficiency there. There has been a tension between having weaknesses in the past and how these and how the health policy has panned out. But I also think that also interesting is this tension between, again, the efficiency in health policy and freedom. So we can see that countries that have implemented stringency measures successfully and quickly have been the ones that have been more able to manage the pandemic, but often that has been at the expense of some individual freedoms. And interestingly, people have willingly surrendered those freedoms in order to have a more effective health policy. So from the perspective of party politics, this has been a crisis that has presented populists, but also mainstream governments with challenges. The pandemic challenges the populist anti-expert narrative. If you can't address the health crisis, then you're not going to be voted in. It's a question of valence. But it has also, like any other crisis, become an opportunity for those who support democratic backsliding to take away some human rights. So a lot of tensions there, and I think a lot of important trade-offs that the pandemic has shown, also a lot of interesting comparisons. None of this is unprecedented, the way I see it. We've had a Spanish flu, we've had a lot of other similar crisis phenomenal challenges in the past. So it's interesting to have these perspectives when we try to understand the relationship, both past and present, between the COVID-19 crisis and democracy. So we have four very interesting speakers today that will try to address this relationship from their different perspectives. Each will speak for about 12 to 13 minutes, and then we will be taking questions in the end. You can put your question in the little Q&A box, which is at the bottom of your window. Feel free to put a question in any time, even at the end of the first or the second talk. You don't have to do it in the end. What I will do is I will collect the questions and pose them to the speakers. So without taking too long, I would now like to introduce our first speaker, which is Gizem Arikan. I hope I have pronounced that correctly. Gizem is Assistant Professor of Political Psychology in the Department of Political Science at Trinity College, Dublin. Her research focuses on the effects of religiosity, values, and authoritarianism on political attitudes, including attitudes towards democracy. And she has published, indeed, in top journals, such as the American Political Science Review, the British Journal of Political Science, Comparative Political Studies, Political Psychology and Political Behavior. She's also the winner of Turkish Academy of Sciences 2015 Young Scientist Outstanding Achievement Award and Science Academy Young Scientist Award in 2016. And she will be talking to us today for the next 12-13 minutes. So Gizem, to you.
Okay, thank you very much, Daphne. I am going to share my screen first. Okay. So again, thank you very much, Daphne. My talk is about how we respond to threats in our environment and how threatening situations may undermine popular support for democratic norms such as civil liberties. I'm going to be presenting some evidence from a recent study showing that even individuals who value freedom and autonomy are susceptible to the effects of threats. So dangerous situations such as an infectious disease like COVID-19 lead to fears among individuals that they themselves or their society could be affected. They may fear that they or someone that they love may get sick, may die, or they may be worried about the well-being of their nation or of their society. So we call these type of fears perceived threats. And as we are all aware, COVID-19 has also had immense effects on the economy. So individuals may also fear the consequences of bad economy. And again, they may feel these threats at a personal level, that they are insecure or they may be economically insecure. But they may also fear the consequences of this economic situation of shrinking economies for their society as well. So both types of threats have been found to be prevalent among the public, and usually COVID-related economic threats were more prevalent in public opinion surveys. So I wanted to focus a bit on what these threats mean for individual support for democratic freedoms. Just try to move on to the next slide. So a lot of research in political psychology shows that threats have wide-ranging implications for political attitudes. So when individuals are faced with a threatening situation, they would like to find a way to reduce these threats. So they want to feel more secure. One way of trying to resolve this threatening situation is by supporting strong, forceful, powerful leadership. So during crisis periods, we usually see greater support for strong leadership. Coalescing around the leaders is one way to deal with this increasing sense of threat. Desire for increased security also leads to widespread support for tough law and order policies. These policies usually ensure safety and security, but they come at the expense of individual freedoms and civil liberties. Overall, there is, again, increased support for these type of policies that trade liberty for security in crisis period. And perceived threats are also related to the desire for retaliation. So people are generally more willing to support harsh punishments for people or groups that they feel threaten public safety during these periods. Now, as you can guess, individuals have different levels of susceptibility towards these threats. So some individuals are more affected and some individuals are less affected by these threats. What I'm going to show you is that certain type of threats can actually influence even the most freedom-loving, autonomous, open-minded individuals. So in the rest of my talk, I'm going to refer to a psychological orientation called authoritarianism to explain this dynamic and its relationship to perceived threats and support for anti-democratic attitudes, if you will. So authoritarianism is a psychological orientation that reflects a preference for order, conformity to norms, and deference to authority, as opposed to individual autonomy. So if authoritarians are to choose between authority or autonomy, they are likely to choose authority. And this is because these people are generally like to perceive the world as dangerous and threatening. And so in general, they are more likely to support strong leadership or tough law and order policies, because these policies are in line with their motivation to attain security. And their level of support for these type of anti-democratic, tough policies tend to increase if authoritarians perceive threats to existing social order. So how about those who are at the other end of the spectrum, so non-authoritarians or those who value autonomy over authority? I'm going to show that some types of threats also make these individuals act very much like authoritarians, and they are threats to personal well-being rather than threats to social safety or security. So to provide evidence for this, I collected data from a small sample of respondents in New York and New Jersey during April, so when the spread of the pandemic was reaching its peak. And distinguishing between type of threats is not easy in a survey situation. When people are threatened, they tend to express high levels of threat for basically everything. This is why there's a small experiment embedded in the survey. So a randomly assigned group of individuals answer questions on perceived personal threats from COVID-19. Right after that, they are answering some questions about support for some controversial law and order policies to contain the coronavirus. And some randomly assigned individuals are answering first questions on perceived societal or sociotropic threats from COVID-19. And a group of individuals are just answering these questions. So what we want to see here is whether making certain types of threats salient is going to impact the way people respond to these law and order or harsh punishment type of questions. And I just have two very illustrative results. So it looks like the effects were in the way that I expected, and the literature in line with the literature. So when sociotropic threats are made salient, authoritarian support for tough law and order policies increased. So they responded to salient societal threats by increasing their level of support for instance, increasing the number of security forces. And those non-authoritarians, those that are at the other end of the spectrum, also increased their support for tough law and order policies, but it was when they were when personal threats were made salient in the experiment. So again, just some illustrative results. And in fact, I found highly consistent effects of personal threats on support for tough law and order policies for non-authoritarians in the study, again, in line with some of the previous findings in the literature. So there are also, I also found similar effects for support for harsh punishments, but these effects were relatively limited. So there is evidence that public support for anti-democratic policies could increase under threatening situations, depending on the salience of different types of threats, but these threats, again, could influence even the most freedom-loving individuals. So before I conclude, there is one caveat or one going further point that I would like to mention. One robust finding in the political psychology literature is that threats trigger a whole spectrum of other behaviors. And one type of this behavior is increased prejudice and intolerance towards threatening groups or outgroups. So people perceive outgroups as more threatening. And these groups need not be the source of threats. So during periods of economic insecurity, prejudice or intolerance towards religious minorities, immigrants, or foreigners may increase. I have not yet looked at the effect of personal threats on non-authoritarians' levels of prejudice, but this is a possibility. I would like to answer your questions in the Q&A, so thank you very much.
Thank you so much, Gizem, for that. That's very interesting. We already have a couple of questions. I have a couple of questions too, but that's all for later. But for now, let me introduce our second speaker, who is Konstantin Bousalis. I will say that in the Greek way that I know. He's assistant professor in environmental politics and quantitative methods, also in the Department of Political Science at Trinity College, Dublin. His work focuses on climate change communication, specifically origins and impact on public opinion and policy making, and he uses computational methods to study political communication. He's currently working for the European No Face Network on a project on extreme identities, and will present to us his perspective on COVID-19 and democracy today. To you.
Okay, can everyone hear me? Okay, sorry about that. I'm so sorry. Okay, so hopefully you'll be able to see my screen. Okay, so wasting 30 seconds right there. Sorry about that. So I'll be presenting some preliminary work that I'm conducting with Stefan Bale, Travis Cohen, and Laszlo Horvath from Exeter, on how the media is covering COVID-19 pandemic. And so in this presentation, even though we're doing a larger study looking at the US and the UK, in this study, we'll be looking at, I'll be discussing the US only. So just a brief introduction, the COVID pandemic is showing how adequate policy responses and public behavior and changes in public behavior is crucial for limiting fatalities. One of the key determinants of these responses and behaviors, in our view, is how the disease is represented or framed by major news media. And when we talk about a frame, we're saying a frame is typically understood as a central organizing idea or study or storyline that provides meaning to an unfolding strip of events. So framing can be understood as a strategic tool used to emphasize or obscure certain aspects of perceived reality in order to promote a particular interpretation of an issue. So there is past research on framing of epidemics. Notably, the focus has been on the HIV/AIDS, Ebola, and there's also some more recent work on SARS that we can draw on in terms of understanding what frames have emerged when the media are discussing epidemics, and also the dynamics of these frames. So what can we learn from past research? Well, first is that epidemics are framed in different ways, and 5 frames are generally emerge when the media discuss pandemics. These 5 are that it's purely a scientific, technical, medical issue, or that this is a public health policy challenge. These are very familiar to us now today, I believe. But also there are frames that kind of discuss the crystallization of pre-existing human rights or development problems, or that the pandemic is posing a fundamental or national security threat, or even, and this is probably more, common for the HIV/AIDS coverage, but that there's some type of moral panic here, that there's a deviant subpopulation that's responsible somehow for the epidemic. This is also we also see this a little bit with Ebola, but the scholarship on SARS and Ebola also have emphasized the notion, the frame that this is a quote unquote foreign disease, that this epidemic is a result from inferior practices, say, of a foreign region or a foreign culture. Another key finding from this literature is that framing in the news varies on political line of an outlet and also by the type of outlet as well. So that's the first finding. The second is that the framing of epidemics can impact public the public perceptions and also policy making. So framing of a health issue in one way or another can have potentially serious negative consequences on these outcomes. So for instance, in the literature, there's been discussions on how the security or the foreign frames that we discussed, that I just previously mentioned, can have actual impacts on pragmatic and normative grounds. So for instance, if there's a focus on the security aspects of the pandemic, this can lead to restrictions on fundamental liberties that can outlive the epidemic, and I'm sure that we'll be discussing this more in depth in this panel. But also there can be a shift towards preferences for short-term responses that that overlook kind of tackling structural roots of the epidemic's long-term negative impacts. The third finding from the past research is that framing can shift dramatically as the epidemic unfolds. And so what I mentioned here is that there are pivotal moments that have been shown to trigger framing shifts in the past. So if we take an example from Ebola, Gerlach mentions how the Western media in the author's content analysis shifted from a discussion or framing of preventative measures to quickly to preemptive measures when Western countries began to be exposed to the epidemic. So the discussion or the framing typically began with kind of the outbreak is a result of quote unquote primitive African practices, which then led to an emphasis on kind of technical solutions and humanitarian aid to be sent to these foreign regions. And but this quickly shifted to a need for robust Western government intervention and medical action, robust biosecurity on the side of the Western countries, for instance, flight bans, and also discussions of global species networks, etc. So it becomes a systemic issue. In this I'm going to be showing preliminary findings here. What we're interested in is kind of seeing if these frames, to what extent they are prevalent in the current context in COVID-19, and also looking at a diachronic analysis of the major frames in the US news media, and potentially looking at locating shifting points and highlighting differences across outlets. So two kind of preliminary questions here: are there differences in framings by outlet in the United States? And do we observe noticeable shifts in framing over time? So we collected all online news articles mentioning coronavirus or COVID that were published on most popular US news domains between the period December 2019 and April 2020. This returned a little over 82,000 news articles. Here's the outlets. The outlets that we're looking at varies by type and by ideology. From newspapers, we have Washington Post, Wall Street Journal, USA Today, New York Post. We also have online articles from television outlets, Fox News, CNN, ABC, NBC, CBS. We also have radio, which is National Public Radio, and also we have an online only outlet, Breitbart, which is if you're not familiar with it, is a kind of very right-wing outlet. So I'll be discussing two different methodological approaches that we do to kind of measure these frames. the existence of the frames. The first is a topic modeling approach. This is an unsupervised machine learning model that's applied to this corpus. And here we're able to uncover the latent themes that run through this corpus. We can discuss this in the Q&A, but we argue that these underlying themes that are generated by the LDA model can be interpreted as representations of distinct media frames. We generate 56 topics from this model that are then mapped onto these larger frames that I just discussed. Also, we look at the word co-occurrence networks from sentences in this corpus that explicitly mention the coronavirus. And here we're trying to get at a more granular framing of the discourse. So I'll quickly pass through here. This is just, I want to discuss the mappings of these topics. So basically the takeaway here is that of these 6 prior frames that were found to be prevalent when discussing pandemics, we can only really map on topics to 4 of them. And here they're listed. I'm not going to spend more time here, but in the Q&A, if you're interested, why don't we see, say, this foreign disease, which anecdotally, we all know that right-wing outlets in the United States definitely do discuss this. This is probably a limitation of the LDA model, but also perhaps a limitation of our, or basically more work is needed. But we also find these new frames as well. So an economic shock frame or a social shock or global challenge or even political tensions emerge as frames in our analysis. And this, I think, speaks to the fact that how systemic this crisis is and the challenges that it poses. So here are some preliminary findings from the topic modeling analysis. So the way to read this is just basically that we have multiple outlets here that I mentioned. And here is for any given week from January to April. This would be if you were to pick up an average article from this outlet, what proportion of the words in that article would be attributed to this frame here. So what we can see here is that a very large percentage of the words discussing coronavirus had to do with medical problem frame in the beginning of the crisis, but that this basically tapers down as time goes on. Although I should mention that even at the current level of 10%, that's quite high actually. We see a little bit of a bump when the United States starts to experience an increase in cases. But if we were to move on to the economic shock frame, which is a new frame according to our analysis, what we see is that there is divergence in the prevalence of this frame across outlets. So the Wall Street Journal is talking a lot about the economic shock, but then outlets that are loyal to the current government, Fox News and Breitbart, seem to downplay this frame. Similarly, with political tensions, we see that Breitbart is very much discussing the political aspects of this and scandal and so forth, whereas more mainstream outlets like CBS or USA Today and others are not really discussing this outcome. Now, if we, I know I'm running a little bit over right now, but if I just have 2 more slides, if we were to look at the co-occurrence, so words that are related to, that exist in sentences that have the term virus or coronavirus in it, I'm going to compare now the Washington Post to Breitbart. We see that in the beginning of the crisis, there's a lot of discussion of the medical aspects of the disease, but as we move forward, there's kind of a discussion of the pandemic in the United States and response. But if I'm to compare this to Breitbart, what we see is that China, Wuhan, and the communism in China and the government is central to the discussion, even going into April. So there's a lot of blame shifting here, and there's a lot of focus on the response of the Trump administration here. It's very politicized is my point here. So my last slide here, and I'm sorry for going over, is that we can see that, yes, indeed, there is, that there are frames that were in the past prevalent that we see here today, but we've seen emergence of new frames. But we also see that there are clear differences in framing by outlet. and that this is driven by ideology and partisanship of the outlet, and right-wing outlets supporting the government focus on blame shifting and otherness. And we have some points here about that this is early stages and that there's more work to be done here. I'm happy to discuss that in the Q&A.
Great, thank you so much, Konstantin. Again, another very interesting presentation. We already are having quite a few questions coming in. I'm saving them obviously for later. Let me now introduce our third speaker. This is, again, I apologize for my pronunciation. This is Zoltan Fazekas, an associate professor of business and politics with a focus on quantitative methods at the Department of International Economics, Government and Business, Copenhagen Business School. He has a PhD from the University of Vienna and has held visiting positions at Nuffield Mannheim Center and the GC's Leibniz Institute for Social Sciences. His research is at the intersection of political psychology, political communication, and comparative politics, and mostly applies quantitative text analysis and hierarchical models. So he's also published in top journals, including the American Journal of Political Science, the British Journal of Politics, Political Psychology, and the Journal of Communication. And we very much look forward to your presentation, Zoltan.
Thank you very much for the opportunity to present today. I hope you can see my slides. I'm not necessarily sure which device. Okay, sweet. So thank you for the excellent opportunity to present here. And I will be talking a bit more about school reopenings post-COVID-19 in Denmark, and we'll be presenting joint work with Jens Olau, my colleague, who's also on the call here. More precisely, I'm trying to move slides. Okay, more precisely, we're actually looking to assess the effects of post-COVID school reopenings on a variety of different outcomes. And we believe that this is quite important if we want to better understand kind of the long-term effects or the short-term effects of a lockdown if it happens again, but also it contributes a bit in terms of the discussions that we might have how to reopen the society, or how exactly are we kind of trying to find a balance in between public health and trying to reduce some issues related to some of these economic, political, and personal negative effects that have been already mentioned. So we'll be assessing this or parts of these trade-offs, looking at this staggered school reopening in Denmark, where there was a threshold in terms of who was allowed to go back to school. And we will be looking at this also as in terms of much of the public discourse here in Denmark has been looking at it as an experiment. Quite some people were very critical about this idea of treating kids almost as guinea pigs in the beginning. So we collected 2 waves of survey data from parents, and we will be looking at parental stress levels, economic outlook, and political support, but also child well-being in this particular setup. And we'll be looking at various comparisons in the future. So before that, I just quickly want to give you a glimpse of a timeline. So around mid-March, there was a closing in Denmark. So there was a lockdown. The schools have been closed. The announcement was made on the 11th of March, but technically you should close the schools closed on the 16th of March, but already on the 12th and the 13th. People were encouraged not to bring their kids to school. So this is how it started. And then there was a partial reopening straight up after Easter. So this is Easter Tuesday. Some kids were allowed to go back to school. So daycares opened, and also some of the school children went back. So the threshold here was the 5th grade. So if you were in the 5th grade or below, you were welcome back to schools, but not for the older children, right? So this is what we call this staggered reopening or partial reopening. And then the situation kind of converged when it comes to regular schools or lower secondary grades only later in mid-May, where everyone was allowed to go back. However, I already want to point out here, it's important to note that there were a lot of regulations how this reopening happened. So there was distancing kept within the schools, and so on. So obviously not each and every school opened the next day, and there was no full capacity opening if you wanted to keep the space as well. So in this period, first we interviewed around 1,300 parents right after Easter. So in the first week after Easter, which was in the first week of the partial reopening, and then returned kind of in the 3rd week of this partial reopening going, and around 1,000 parents decided to respond again. So the main criteria here was that the respondents had to have at least one child in the 4th, 5th, and then 6th or 7th grades in either of these. So since the 5th grade was this kind of threshold that creates some sort of a difference between different group of parents, we collected data from those who were below this threshold and slightly above this threshold, right? So if you had kids who were in the 6th grade, then they did not go back, whereas if you had kids in the 5th grade, they went back. But this allows us to do some more interesting comparisons where you have hopefully very similar parents, very similar children, and sometimes oftentimes even similar households. So before looking at some of these results, I also want to highlight that there is this very, very big disclaimer basket that I want to discuss, or at least point in this direction. So we need to be very careful. If what do we learn from this experiment? It's obviously contingent on how the timing of the reopening, the timing basically of the lockdown. Where were we in terms of cases reported? Where were we in terms of infection rates? And how's the healthcare system, which hopefully will come back as a point of discussion also based on the introduction. And the second part is there was very high compliance within the Danish society when it comes to the lockdowns. And there was quite high trust when it comes to the people who were implementing the lockdowns and then implementing some of the reopenings. But there was already a change in kind of the political consensus. There is a problem of endogeneity, or I will call it a problem of endogeneity. So obviously the success, no matter what sort of metrics we're using to evaluate this, but the success or the failure of a lockdown will kind of influence when and how the reopening policies will be either implemented or how successful they will be. And of course, again, there were a lot of school regulations. So while we're talking about reopening, so some kids were allowed to go back, probably this is still far from normality in terms of what was your experience prior to these lockdowns. And of course, in terms of data collection, we had some parallel changes. So some occupations were allowed to go back to work, and these are kind of short-term effects, and we never really ascertained when your child went back to school. So we just used the proxy of whether your child was allowed to go back to school. With this in mind, first I just want to review a couple of very simple differences. So we look at parents, we look at the first wave and the second wave, and we're just looking first at differences, and then I'll be highlighting the differences depending on whether you were in the group of parents whose children went back to school versus those who did not. So in the beginning, we looked at parental stress. These are 3 items from a short form depression anxiety scale. And what we see here is lower values mean less stress. And so that's good, I would assume. And the whole range would be between 0 and 1. So what we find is overall, there's a slight decrease in parental stress in between the 2 points that we measure this. So as we went along, there was decreasing amount of stress, which can be due to many different things. Now, if we look at these kind of differences, so here we can see that this is mostly something that you will find among the parents whose kids went back to school. And this is highlighted in the purple numbers in this slide. So this is also for the future. Basically, we're looking at the differences depending on whether your kids went back to school. That will be purple. So you had kids below the threshold, and then some of these differences and also the means are highlighted here for the comparison group, where your kids had to stay at home and still get additional homeschooling and caring. That will be reflected again in this green color. So what we found first is that there's a decrease in kind of the parental stress levels, and this is more pronounced if your kids went back to school. So another way to think about it, there's kind of this divergence between these 2 groups of people throughout the time that we're measuring what we're measuring. So the differences are getting a bit larger depending on whether your kids went back or not. And this is roughly, again, 3 weeks in the whole reform. Then we looked at economic outlook and work considerations. We asked parents how the corona crisis affected your household's economic situation, what % of your work you could actually carry out at home compared to a regular working week, and how concerned you are about your employment in the future. given the current conditions. And here on this plot, you will see that everything goes, basically the higher numbers are better outcomes or the positive outcomes. So you're more optimistic about the economy, about your job, and you were able to carry out more work. And there's a bit of truncation in the figures, but just to have it here in one figure, all these three, we did that. So just because in the first economic well-being, you see kind of lower values, that's still middle of the scale. So pretty much in between, no big positive or no big negative influences. But what is the main takeaway point here is that we don't really find large differences. We find some kind of increase in the work capacity as we compare the first wave to the second wave. And again, this is slightly more pronounced when it comes to those who had their kids allowed to go back to school. So these are small differences, but slightly more pronounced for the parents who were, so to say, benefiting from the reopening that was going on. Now, the politics part is where we actually find differences, and this is quite interesting. We were looking at simply the Prime Minister's approval or kind of support, how they were doing, and then also the Danish health authorities. There were two institutions responsible, mostly as an administrative phase of the response to COVID, and they were oftentimes criticized also in the media. So we see that there is a decrease in support. That is both the case for the Prime Minister and also for the health authorities. And we can see that these are very similar patterns. So we all have these decreasing patterns. They're slightly more pronounced for those people who were not benefiting from the reopening, right? So if the kids were still at home, that is the group where we find a slightly larger decrease in between the two waves. But all of these are pointing in a direction that probably there might be some different mechanisms in terms of either politicization or approval or trust when it comes to comparing reopening versus just bringing in a lockdown. But we also need to know, note, of course, that there were very high levels of trust still, right? So all these authorities and the Prime Minister was very highly trusted. Now, when it comes to the child well-being, we asked parents to report on 3 different measures, and I'll just very quickly mention this, that we find very, very minor differences. So overall, first of all, between wave 1 and wave 2, these are very kind of small differences. Now, we don't find anything very specific when it comes to the kids who went back to school in terms of well-being, whether they feel relaxed or whether their parents think that they feel relaxed and how they're behaving. So this was not specific. There was no, nothing is masked if you went back to school or if you stayed at school, given our data at hand. There is a slight decrease in how relaxed these kids were, but I mean, we started measuring this after Easter, which comes after an Easter weekend, which might already start quite high in terms of how relaxed the kids are perceived. But overall, we found very small differences here. Finally, we started looking into some exploratory differences between how mothers and fathers experience this, because obviously they might be quite large differences here. And I'll be using a different depiction here, but so if we see purple here, it means that kind of mothers were scoring lower, so they were worse off. And we can see that overall, that mothers in comparison to fathers were more stressed and had lower working capacity, but they were also more favorable towards the political entities that we have been looking at. And then we have some differences regarding to some of these economic well-being. Now, it's maybe more interesting to look at this as kind of a question of convergence or divergence again. And in a similar manner, what we see here is that there is an increase in the parental kind of well-being and work capacity for mothers. And this is a bit more specific actually for those mothers where the kids were able to go back to school. So again, this is for future considerations. We might want to consider who has the more difficult time and how some of these reopening strategies might have differential effects. in this particular case. But when it comes to kind of the political support, then we see much more homogeneity across or between mothers and fathers. So again, with in mind with some of the limitations that I introduced, we find very small to no differences when it comes to child well-being. We find a decrease as reopening unfolds. There is kind of a decrease in parental stress, which is more pronounced for the mothers, and it's more pronounced in the case when you're actually benefiting from the reopening, in the sense that your kids are going back, which is very similar to workload or how much work you can actually do at home. So these kind of overall differences that we're trying to look at and try to evaluate or assess what we saw in Denmark. But again, there is no explicit analysis of trade-offs. So if you look at the reports, in the beginning, there was an increase of the infection rate, which then tapered again, and then that's when the second wave of reopening or second phase of reopening happened as well. So it's important to put these results in context also in terms of how the lockdown was implemented, and you can find more detailed results in the report, or you can just get in touch with either of us. So this is kind of the initial contribution for this coming from some Danish survey data regarding the reopening.
Excellent, thank you so much, Zoltan. Again, very interesting findings indeed. For me, mostly the ones on the political attitudes. I found that very interesting. Maybe I'll ask you something later, but yep, there you are. Okay, I'm back on my screen. So to introduce our last but not least speaker today, this is Roman Gabriel Olar, Assistant Professor in the Department of Political Science at Trinity College, Dublin as well, received his PhD in Political Science from Essex, and is also a research fellow at the Michael Nicholson Centre for Conflict and Cooperation at the University of Essex. His research focuses on the politics of authoritarian regimes, state repression, civil military relations, and democratization. And he has also published in Comparative Political Studies, as well as Research in Politics and the Journal of Peace Research. So I very much look forward to your presentation.
Thank you very much for the introduction, and thanks everyone for being here. Hopefully you can see my screen. And today I'm going to talk about a debate that has been quite prevalent since the beginning of the pandemic, and what, or more precisely, what did the quarantine mean for democratic politics, right? Because as Devni said in the beginning, while all the countries were exposed to the same kind of stimulus or to the same event and have taken very similar measures, those things mean very different things for the different countries, and what those measures mean for the country very much depends on their institutional makeup. So I'm going to focus on this distinction between democracy and autocracy, and try to look at how these democracy and autocracies responded to the pandemic, although it doesn't necessarily mean that they are more efficient. And also I'm going to try to discuss towards the end what are the implications of for democratic governance. But the quarantine meant that all the countries imposed high levels of restrictions on their civic spaces, on their societies. Maybe more so, democracies impose these restrictions, something that a lot of citizens living in democratic societies have never experienced or never expected. But also the imposition of these restrictions was perceived, and there was a lot of discussion in mass media, that a lot of political leaders have used the quarantine as a means to consolidate or keep political power. So probably the most mentioned example is the one of Viktor Orban in Hungary, that used the law of emergency laws and gave him power to enact to decrees for unlimited time. But also other regimes such as Duterte in the Philippines has relied on emergency laws, and most other countries in the world have relied on emergency laws to enforce the quarantine. And also, this was in certain cases was used as a blanket approach to also eliminate opposition, not so much in terms of enforcing the quarantine, but also certain leaders were able to imprison the opposition or their critics for criticizing the approach of the regime in handling the pandemic. And I'm going to situate my talk in this debate in the political economy literature that takes, as you would expect, two very different takes. So the early political economy literature says that, well, autocracies are better managers of crisis, and they draw these insights from the literature on the differences between democracy and autocracy on economic development, right? And they say that, well, democracies are better able to manage a crisis because they don't have as much accountability, and they can take measures that might be unpopular with the public, but these measures could also be very efficient, or in theory could achieve the objectives that they have in mind. And in this case, for handling a pandemic and forcing people to stay indoors might be a very unpopular policy, but also might achieve the objective of flattening the curve by interrupting the transmission chain of the virus, right? And part of this idea is also how China presented these efforts and engaged in this propaganda, saying that China was in the best position to take effective measures simply because it doesn't have to respond to its own citizens. But the alternative view on how to handle crises and how to handle policymaking in general comes from the developmental literature that says that, well, generally democracies perform better in dealing with crises because they have more accountability. They bring more input from different groups into policy making, and also by bringing input from different groups, they also have better compliance from all the actors in the society that accept the necessary measures to deal with the effects of a crisis. And historically, it has been true that actually democracies tend to perform autocracies when it comes to reducing deaths from epidemics. So a few months ago, the Economist, when was right in the beginning of the pandemic, showed the results of an analysis that shows that historically the death rates from epidemics, whether it's the SARS, the Ebola outbreak, or some other type of healthcare crisis, the death rate tended to be higher in non-democracies versus democracies. But then when we look at the COVID cases, what we observe that there is actually a non-linear relationship between the number of cases and the level of democracy. So here on the y-axis, on the left-hand side, you see the natural log of cases per million of inhabitants, and down here you can see the VDEM electoral democracy index, and we see there's a curvilinear relationship between the number of confirmed cases and democracies. And given that we know that autocracies were more likely in the first instance to suppress information and to underreport the number of actual cases, and there's a good likelihood that the number of cases is much higher at lower levels of democracy. And also, before moving forward, I want to say that the usual caveat applies to this data, in the sense that this is very preliminary data, and it's also very, very noisy data. But to what we have, this is the best data we have on the confirmed cases. And when we look at the deaths, we see a similar relationship with higher levels of deaths at lower levels of democracy and at high levels of democracies, and lower levels in between. But once again, because the number of deaths are most likely underreported in autocracy, it could very well be that, again, the number of deaths in the case of at lower levels of democracy might be higher. But when it comes to the restrictions that countries have imposed, what we see a bit of a different approach, or a very different pattern in terms of democracies and autocracy. So I relied on Oxford data collection on countries' policies as they relate to COVID-19 to look into the extent to which democracies and autocracies have imposed restrictions when it comes to school closures, when it comes to canceling public gathering and events, imposing stay-at-home orders, or even restricting freedom of movement, both internally and internationally. And what we observe in this graph, we observe that democracies on average imposed higher levels of restrictions, or their index of restriction was much higher compared to autocracies. And on an index from 0 to 100, the difference is about of 3 points, and the difference between autocracies and democracies is statistically significant. So the t-test shows that the level of restrictions is much higher and in democracies, and this is statistically significant. Also, when we look at whether and how these regimes have offered economic support, we see once again that democracies have outperformed autocracies, being much quicker and offering higher levels of support in terms of income support and debt relief, both for individuals and for businesses. And we see that this difference it's huge. It's about 23 points on average. And again, it stays statistically significant throughout this whole period. So we see that democracies in a way perform as we would expect in this case, in the sense that they are more likely to respond to the economic needs of their citizens. And this graph, it's really interesting because this graph tries to show the extent to which the application of restrictions and offering economic support has moved in tandem. And we see that while democracies were much quicker and imposed high levels of restrictions, also they try to keep up with the level of economic support they have offered. And although they were a bit slower than with the restrictions, they still tried, the two follow a very similar trend. On the contrast, autocracies, as one would expect, imposed the restrictions, but were much slower and had overall lower levels of economic support. So once again, showing or offering some type of evidence that autocracies are less likely to be responsive to the needs of their citizens, but then they are quick to use any kind of restrictions deemed necessary to achieve their political objectives. When it comes to health policies, or when it comes to policies that are being applied directly to contact tracing, to policies, right? We see that although the graph shows that initially there's a huge difference between autocracies and democracies, something that is most likely driven by China and by its neighbors having experienced the effect of COVID-19 pandemic much quicker. After the number of cases started increasing in the rest of the world, this difference between democracies and autocracy in terms of their health policy, of their contact tracing and their testing policies stops being statistically significant. There seems to be no difference between the two. However, the important caveat here is that the devil is in the details, in the sense that this data only captures the extent to which these policies exist, but it does not capture how efficient these policies were, right? So in this case, what we see that both democracies and autocracies were equally likely to declare that they have implemented policies in terms of public information campaign, in terms of testing, in terms of contact tracing, right? But the extent to which their policies were efficient, it's a lot harder to gauge because we don't have access to the data to which they were actually implementing their contact tracing on their testing policies. And that in a way bears the question on, have democracies done better, or were democracies better equipped to deal with this pandemic. And on the first instance, there seems to be that democracy seems to have taken the so-called more socially desirable policies in terms of dealing with the pandemic. And if we look at the number of deaths, if that is any indicator of success, on average, so far, democracies seem to have done better in reducing the number of deaths. But at the same time, this is still an ongoing situation, and it's still a bit too early to draw any strong and powerful conclusion about it. But more importantly, it's what is going to happen next, right? So what can the existing research and what can we tell about the expectations that these restrictions are going to be reversed by regimes, and what is going to make them more or less likely? So there are a few insights that we can draw from the literature on comparative autocracy and comparative democracy. So first of all, very much on whether other countries are going to revert to pre-COVID-19 levels of democracy or freedom of association and social political rights is going to depend on the strength of the opposition pre-pandemic and the extent to which the civil society is going to be able to mobilize in requesting their rights and being able to pressure the governments to reverse these restrictions, right? And this is very important because during the pandemic, it was hard to protest, and we've seen a very big reduction in the extent to which protests have happened out in the streets. Of course, again, the caveat applies to the recent 3 weeks where we've seen an increase in the number of protests. But up to that point, last year, 2019 was a year with the widest wave of nonviolent protests around the world. And there were protests in a lot of different places such as Chile, Bolivia, Hong Kong, Sudan, and so on and so forth. We've seen a huge global wave of nonviolent protest against authoritarianism that was curbed by the onset of the pandemic, and that forced members of the civil society to move indoors and increase their the difficulties they've had in continuing their struggle against these restrictions of political participation. And whether that is because they fear the virus and fear infections, whether it's harder to overcome the restriction imposed by their regimes, ultimately it's going to matter for what we observe on the long-term development of democratic governance. And at the same time, another factor that is likely to matter in terms of whether we are going to see some reversal of these restrictions is the extent to which countries are going to exert external pressure on their neighbors or on their allies to try to improve their levels of democratic participation and social, political, and economic rights, right? So, for example, the European Union has been quite critical of of Hungary's use of emergency law, and as soon as the Hungarian parliament adopted the law that gave Orban unlimited power, there was a quick wave of criticism directed towards Hungary, right? But in comparative, if other countries such as the Philippines, for instance, it's in a less democratic neighborhood and doesn't have as many external connection with its neighbors that are also tend to be less democratic, there is going to be a lower likelihood for Philippines, for example, to receive external pressure to improve on its restrictions or to improve on its overall levels of democracies. But at the same time, this is not all good news, or the fact that that autocracies were able to impose these restrictions doesn't mean it's all good news for them. In some cases, autocrats or would-be autocrats had to postpone elections that they had in the bag, for instance. So in the case of Russia, the referendum that allows Putin to run for two another 2 6-year terms had to be postponed because of the pandemic, right? And the concern that was expressed to a certain extent, but it's hard to understand exactly because there is some incentive to misrepresent the true intention, was that if the Russian bureaucracy does a very bad job in being able to deal with the effects of the pandemic, that is going to show a regime vulnerability. And the same discussion happened in Poland that had to postpone its presidential election because the party that is currently in power was afraid that their ability, or if they fail to deal with the pandemic, is going to reflect and going to show their weakness of the regime, and that is going to cause them on the long term in the election. And similarly for Bolivia, which already had a very contentious election last year, and that was supposed to rerun that election, they had to postpone that election that already has the country split in half in terms of who was the rightful winner of the previous election and what is going to happen next. So the fact that a lot of these countries had to postpone elections because of the pandemic, and that they might not be as efficient in dealing with the effects of the pandemic, might in a way strip their regime naked, or in other words, is going to show their weakness and is going to show the lack of state capacity and their bureaucratic incompetence to the citizens. And even if the citizens might not have full political participation, if they have enough mechanism, that might create pressure for mobilization against the regime. And whether the regimes are going to be punished in elections, or whether they are going to citizens are going to mobilize, they are going to demand for political change. So there is some indication that there is going to these regimes' inabilities to deal with the pandemic might create pressures for mobilization, and ultimately, if there's enough demand for political change, we might see some autocracies collapse, and actually we might see in some cases increases in the levels of democracies rather than these restrictions being irreversible and being long term. Thank you.
Excellent. Thank you so much for very interesting presentations. I think for the interest of time, I will go straight into the question. So the way I will do this, I will read out the questions to you. What I'll try and do is, I'm getting quite a lot, so I will try and summarize. I think let's start perhaps with a question for the whole panel, and then a question directed to each participant. I think that may be the easiest way about it. So I think for the whole panel, and this is a question we got earlier on, it applies to everyone because you've all sort of hinted on this, this trade-off in a way between doing things effectively, but at the same time curbing some freedoms. So I have a question here for the panel. So national emergencies or crisis conditions basically give governments enormous increases in power. And it's true that we can see this in terms of the democratic backsliding. You mentioned Hungary, for example. But what does the panel have to say about how consolidated democracies have used these powers? So that's question number one. Then for Gizem, we got a question quite early for you, and actually this was a question that I myself had. So, so someone said, how can we reconcile this claim that you made that, that even the most free of people, which I found really interesting, can be super authoritarian when it comes to threat? How can we reconcile this with these progressive protests, for example, Black Lives Matter, etc., that we're actually seeing today? So for Konstantin, this is a question that I have for you actually. So this was extremely interesting for me to see how you you mapped the different media and how they have used these words relating to the pandemic. But I wonder, and I know this is work in progress, but I wonder what exactly that means. So do you explain, why should I need to know that? What does this tell us about how this different framing has taken place, both in terms of the US context that you mentioned, but also perhaps comparatively, if we think about it? For Zoltan, the question I have for you here is, so essentially you find that school reopenings have no relationship with political attitudes or approval for the Prime Minister, as you said, or the system. And you also mentioned that trust remains high. So how do you reconcile these findings? Or do the school openings mean anything? Do we even care? Did they have any impact? And finally for you, Roman, I have quite a few here. So one of our participants suggests that instead of using the word autocracy to understand what is going on, perhaps we should use pathocracy, the rule of pathologically disordered leaders and groups. And a related question, and I'll stop here and then we'll have a second round, to you, Roman, would be, okay, you talked about autocracies quite a lot, but what about the situation of health services in democracies? What about particularly those in systems that are privatized or semi-privatized and actually present people with huge amounts of bills? Have they been more efficient? And I'll leave it at that for now and let you have a go.
Okay. I can answer not the very first, the whole panel question, but your question about reconciling this situation with progressive movements. So one answer that I have is that threats may also trigger other negative emotions like anxiety, fear, or anger. And anger is a very powerful emotion. So what we are seeing with these protests is maybe maybe the distinct effect of anger. It has been shown to have very robust effects on political mobilization, people's desire to join protests, even if these protests may be risky for them given the police brutality. So that's part of the answer. And obviously, the second answer is yes, threats may make us support quite authoritarian policies. But when the threatening situation is no longer salient, we may go back to our original position. So what might have happened here is anger, basically this powerful emotion of anger taking over. So again, threats may make individuals support tough law and order or strong leadership, but it doesn't mean that these effects are going to be enduring. So that would be my short answer before taking too much.
Okay, super, thank you. Let's go by order of the panel and then we'll go reverse. So Konstantin,
okay,
yes. For you.
Yeah, so I guess the important thing here for us is to first understand what I think that the identification of new frames is important because it signals kind of a new discourse on pandemic reporting. And in the literature there's a discussion, there are discussions on pandemic reporting versus pandemic culture, and pandemic culture being kind of movies like these kind of disaster movies that you see where it shows society collapsing and the heroes are kind of fighting for survival and their individual survival, whereas pandemic reporting is typically about how society is responding and collective action and these respects. And so the important thing here, I think, is kind of what version is being filtered to the publics. And for instance, here we have this new topic like the political tensions, right? Which is a reflection of the times, which is a reflection of the political polarization in the United States, for instance, and how for future research, for instance, this is all kind of preliminary, as you mentioned, and as I mentioned. The question for us is going to be how these new frames impact social behavior. So the sharing of these articles on social media and so forth, which we have data on, how does one, which frame gives the most pop? That would be one aspect of this. Of course, these new frames also signify kind of, again, a reflection of the impact, the kind of systemic impact of the COVID crisis, but then also we're able to now see which outlets are downplaying or focusing on different aspects of the discourse. And we can have clues as to why, which is basically partisanship and ideology. And this all matters because, again, it's these discourses help construct the reality that's perceived by the public, and that of course leads then to behavioral changes. And so if we have contrasting views on what reality is, this will have, we argue, severe negative impacts.
Super, thank you so much.
I think, so thank you for the question. I think the qualifier here is that so support or kind of approval for the Prime Minister is still quite high, although this is the only one where we find this kind of consistent decrease. So it's interesting in a way. One potential narrative, and Jens Olav, who's also in the call, if he can correct me, given that he probably follows much more Danish politics, is that so essentially as the lockdown was prolonged, or especially the group of people who were not benefiting from the reopening, that's where we start seeing the disapproval increasing, or basically the approval decreasing. So it has an effect in a sense that maybe it is related to some people look for different competences or qualities when it comes to reopening versus when it was about just initiating the lockdown, or the other just might be kind of this fatiguing during the lockdown. So I think it highlights some of the, broadly speaking, kind of how do we make up our mind, depending again whether this has some sort of a direct personal relevance for us or not. And that's kind of what we find in terms of the reopening differences. But again, in the context that these numbers are quite high, right? So there is a high kind of support or approval. Finally, again, I think that what we're trying to look into, and it might be obviously too early because it's a very short time period, it's related to this idea again that maybe taking the decision of locking down was less politicized than how people are politicizing what sequence or which exact steps we're taking when it comes to opening up. So I think that that's the second kind of layer that we would want to consider more in detail, how that matters for the approval or for kind of political support that we're finding in this particular case.
Thank you. Roman.
Yes, thank you very much for the questions. These are very, very important and very interesting questions. So I'm going to start with, I think, the broader question for the panel about how have established democracies used these emergency laws. So I think that in terms of the way they use them in a very similar way as autocracy. So in other way, the impositions of the quarantine, of these restrictions on freedom of movement, freedom of assembly, canceling mass gathering has been very similar in the way it looked, right, in the form of the way that was imposed. However, in the substance, in the way they were implemented, depended on many different factors. So for instance, we know that democracies have higher levels of trust and higher levels of democratic satisfaction compared to autocracies. So there's also more, that means that there's more likelihood that citizens are going to be more compliant with these, but they trust their governments because they know that those institutions are working enough that these established democracies are going to reverse back to pre-COVID-19 levels, right? So, for example, in the case of Israel, there was a debate that the intelligence services were using contract tracing apps, and they were using surveillance mechanism very similar to what they're using to track so-called terrorists, right? And everyone was concerned about what it meant for the privacy of the citizens. And very recently, about a week ago, they announced that they have stopped that program, right? So it could be that the democratic pressures even on intelligence services has been enough to be able to reverse some of these restrictions, right? So as I was trying to convey in my presentation, although they look the same in form, in terms of the substance and their likely effects on the long term are going to be very different, simply because democracies and autocracies, or consolidated democracies, if you want, to have very different levels of trust, of democratic satisfactions, and expectations of the public, and the ability of the public to shape politics long term. In terms of what should we call them, pathocracies? I think that sounds like a very normatively loaded term, right? And I think it's very hard. And it's very hard to say what are the pathologies or the psychological pathologies, and maybe Gizem has more insight on this, of leaders in autocracies versus democracies, right? Clearly, there's a selection effect of the kind of individuals that choose to go into politics, but also there's a selection effect into the type of individuals that choose to go into democratic politics versus autocratic politics, in terms of what is the extent to which they're willing to go to achieve whatever objectives they have, right? So that would be very hard if we try to adopt this pathological view on democracy versus autocracy. It would be very hard to have a cross-national comparable terms into what makes certain individuals more pathologic than others and their supporters, right? So I think that these distinctions between autocracies and democracy, and there is a huge literature debating what is the actual difference. Is it in form of substance, or is it in terms of form? In other words, is it that simply having free and fair elections matter, right? Or is it more so that the outcome of democratic or the political process is the one matters that separates autocracies and democracy? Because if we look at Hungary, it had overall free and fair democracies, right? But for the past almost 10 years, it's considered to be an illiberal democracy. So again, this shows how difficult it is to have a separation between regime types that in a way satisfies everyone understanding about what democracy is. Because even when you ask people what democracy means for them, you get very wide-ranging responses, whether it's freedom of speech, freedom of media, free and fair elections, working institutions. So it actually matters a lot what it is. And finally, about the health policies. So the data that I showed simply captures whether the government has announced that they are having contact tracing policies, whether they have public information campaigns on health, but they do not say anything on the efficiency of those campaigns or the type of support they offer to their own citizens. And I think that most likely there is a very huge variation in terms of the quality of the health services that individuals receive in these different regimes, but I'm not 100% sure that the quality of the health services can be mapped easily within this dichotomy of autocracy and democracy, right? Because like Daphne mentioned in the beginning, it showed countries that you would expect to have a low state capacity, like Greece, actually turned out that it have a very efficient, or its health system was able to deal with the effects of the pandemic very, very well, while other countries that you would expect to have higher levels or better quality in terms of health services have dealt with it much poorly, such, for example, the US, right? So I would expect that this distinction between health services, public and private, might matter, but again, I'm not aware of any data that allows us to look into that at the moment.
Thank you very much. So we have run out of time, but I understand we can run over a little bit. And so what I'll do, we have a couple more questions. I think they're directed to the whole panel. So I'll just set them out. And then if you can just give us a very, very brief answer, one sentence each, and we can conclude with that. Funnily enough, they tend to be those kind of questions that political scientists are a bit about the future. So, so one question I have here, and I'm interested in what you think as well, is do you think that these concerns about safety and stability will increase Trump's chances of re-election? And I would broaden that question, in fact, to say, actually, how do you see the electoral potential for both democratic and not so democratic parties, given the situation, if everyone can answer that. There has been also a question, I think, Roman, you touched on it a little bit, but perhaps somebody else would like to also say something about the extent to which you think the new apps that have been introduced will exacerbate the trend towards this erosion of liberties. And finally, Roman, I have a question for you. This is from me to you. And my question is, okay, I buy this because I've done a little bit of research myself on the data that you focused on democratization and also decentralization. But the more I look into this, the more I'm convinced that we should actually be looking at variations within democratic regimes rather than between democracies and autocracies. And I'd like to hear what you think about that. So let's start with random order. How about Zoltan to start?
I think I'll be very, very short, given that I will subscribe to what you just mentioned, what political scientists do not like to do, such as predicting the future. I would also probably put this rather in the framework of I think it will be interesting to see how much we learn now and how much that will influence future reactions at any level if there will be need for these, which might be more proximate to some of these elections in the future. So I think that we might want to consider again how both politics and the public learns as we go along about some of these restrictions, which might either heighten or dampen some of these effects that you just mentioned. But beyond that, I will not try to predict in this case.
Konstantin?
Sure, yeah, I also I don't even need to mention that I don't want to predict anything. But I would say one thing, which is that starting in April, Trump's polling has, the difference between approval and disapproval has begun to widen significantly. And in other words, disapproval has been increasing significantly for him. And that's probably a reflection of both his administration's handling of the crisis, as well as the now, the BLM protests and so forth, and how he's handled that. Now, in terms of security framing, I guess this is something actually that Gizem could probably give us a little bit more insight into, but I think that so far the communication strategies, I think, have been pretty bad on the part of the Trump administration. And so it's not clear as to whether, what can be salvaged here, but I guess that's my point.
Cool. How about Roman, and then we'll let Gizem have the final word.
Yes, I think I'm going to stay away from the prediction, also because, for instance, no one thought that he would win the first election, and yet he won the first election. So whatever we say, probably we're going to be wrong. So it's hard to, or if we are right, then probably we just guessed it. So I'm going to stay away from the prediction. But in terms of going back to your question about the variation within democracy, 100%, I totally agree, right? Sometimes this is a very crude distinction, and for certain outcomes, this sharp distinction between autocracies and democracies matter much more than for others. But I think definitely that going forward, it's not so much about this sharp distinction, or in addition to the sharp distinction, we should look into the mechanism that matter for explaining this distinction, right? Because it could be that the freedom of information or the level of veto powers might matter more than so much whether this is actually a sharp distinction between democracy and autocracy. So definitely, I think the mechanism are more important than simply this very broad category, because we know that autocracy is different from each other as much as they differ from democracy.
Yeah, thank you. Gizem.
Okay, so of course, I don't like to make predictions, but I usually don't make very optimistic predictions as well, so I hope I'm wrong. But periods of where people seek safety and security, and especially periods where people perceive threats to social order, usually play into the hands of more right-wing conservative leadership. So in that sense, I'm not very optimistic. Again, periods of economic crisis tend to play into the hands of this, hard, tough leadership. But obviously, we do not know the exact, whether people will be blaming the Trump administration or the current administrations in their country for the economic crisis that is lying ahead. So it is really very hard to know, but I'm generally very pessimistic about periods of, unfortunately, threat and insecurity. Not a very, wasn't a very good way of closing the panel.
Yes, it turns out the last word was one of pessimism, but if I can add something positive with that, is that we have although we have run 15 minutes over, actually we have kept the majority of our participants, which means that everybody has enjoyed this panel as much as I have. So I would like to thank everyone for their really interesting presentations. I learned a lot personally, and I'm sure that our participants also did. I understand this recording will be available, so everyone can listen to it again if you wish. And yeah, and so thank you very much. Have a good evening, morning, afternoon.
Thanks everyone. Bye-bye.
Bye.
Thank you very much, everyone, and Daphne and Zoltan and Jens. Thanks for joining us, and hope to see you. Hope to meet you in person in a nice, I don't know, conference location maybe at some point.
Absolutely.
Thank you. Enjoy your summer.
Bye, everyone.
Bye, everyone.